Hello everybody, nutritional scientist Liam McCauley here. I just wanted to create this video today. I just wanted to talk about a little known sort of condition. It's quite an enigmatic and confusing condition to a lot of health professionals and those studying medical science, and that is fibromyalgia. A lot has been sort of discussed about this disease. Some people debate the legitimacy of this disease, but for me, it most certainly exists. And I've just got a few notes here, and then I'll go over a few studies. I want to look at specifically using nutrition to treat some of those symptoms of fibromyalgia. Okay, so fibromyalgia is a chronic disorder, and when we're talking about a chronic disorder, rather than an acute disorder, we're talking about something that goes for a very long time. This isn't necessarily going anywhere. You have to control the symptoms. You can't necessarily completely rid yourself of this disease, or there's at least no guarantee. Okay, it's characterized by widespread musculoskeletal pain, so pain of the muscles and the bones, fatigue. Okay, that's a very common symptom, and tenderness in localized areas. So it could be muscle tissue, joint tissue, things of that nature. It is a complex condition that is not well understood. Okay, that's an understatement. It really isn't well understood at all. Okay, no one can universally really agree on how to define it, even how to diagnose it, really. Okay. But it's believed to involve abnormalities in how the brain and spinal cord process pain signals, okay, resulting in amplified response to pain. They feel pain quite strongly. That acute pain can arise for them at times, and it will be pretty much unbearable. That's why usually you prescribe some sort of analgesic medication to help with those symptoms. Okay. Other symptoms of fibromyalgia can include sleep disturbances, very common, headaches, irritable bowel syndrome, so you can start getting gastrointestinal disorders, anxiety and depression, so a lot of mental health problems. You know, if you could imagine being in pain for that long, yeah, your mental health will decline more than likely. Okay, because there's no definitive test for fibromyalgia, as I mentioned earlier, diagnosis is often based on a combination of patient symptoms, medical history, and physical examination. Okay, so treatment for fibromyalgia typically involves a combination of medications, lifestyle changes, and other therapies, such as exercise, cognitive behavioral therapy with a psychologist, and relaxation techniques, you know, your diaphragm breathing, and things of that sort. Aromatherapy, maybe. Yeah. Although fibromyalgia can be a chronic condition that is difficult to manage, many people with the condition are able to find relief from their symptoms with appropriate treatment. Unfortunately, there are those that receive quite poor treatment and their symptoms are exacerbated for quite a long time. Okay, so the exact cause of fibromyalgia is not known, but research suggests that it may involve a combination of genetic, environmental, and psychological factors. Okay, so some studies have found that people with fibromyalgia may have alterations in the way their brain and spinal cord process pain signals, resulting in increased sensitivity to pain. Yes, something sort of goes wrong in that sort of synaptic cleft where these neurotransmitters communicate or help the neurons communicate with each other. Some sort of disturbance is going on there more than likely. What exactly? Trump's, the best scientist in the world. Okay. Other studies have suggested that the condition may be related to abnormalities in the level of certain neurotransmitters, like I was just talking about, in the brain, including serotonin and dopamine, okay, which have many roles. Serotonin in mood, and dopamine, and actually in a whole bunch of things, but like in movement, cognition, and a bunch of other things. Okay. I just want to quickly go and look at just a bit of the evidence about nutrition. So how can we treat this with nutrition rather than going to see a doctor and taking medications for the rest of your life, which there's no problem with. If you got to take what you got to take. I take some medications for some things, but ideally, let's try and deal with some of the symptoms, symptomatic control using nutrition. And as a nutritional scientist, this is my field of expertise. Okay, this is what where I feel safe enough to give an actual opinion. Okay. All right, so one of the first treatments, and most of these are going to be supplements or herbs of some sort, is Coenzyme Q10. And you might have heard of that. A lot of people use it for treating heart conditions and for energy. And that's its main effect. As you can see here, even it says heart conditions, Coenzyme Q10 has been shown to improve symptoms of congestive heart failure, although findings are mixed. So Coenzyme Q10 might help reduce blood pressure, if you have hypertension. But some research also suggests that when combined with other nutrients, Coenzyme Q10 might aid recovery in people who have had bypass and heart valve surgeries. But what I mainly want to look at for Coenzyme Q10 is its function on energy. Okay, so if we look here, so because Coenzyme Q10 is involved in energy production, okay, so supplementing with it is pretty much universally agreed to boost energy. And considering fatigue is a common symptom of fibromyalgia, Coenzyme Q10 could be an interesting therapy to help with that fatigue. Okay, it's believed that this supplement might improve your physical performance. And so whether you're exercising or whether it's physical performance at work, just getting around a bit easier, okay, must keep in mind research in this area has produced mixed results, which is most most research in nutrition and supplementation um, sort of is like that, unfortunately. Okay, two other supplements I would like to discuss glucosamine and chondroitin. Okay, both involved in the health of the cartilage. Okay, specifically looking at joints. Sort of looking at treating the symptoms of pain and swelling in those areas. Okay, so in osteoarthritis, okay, which is not fibromyalgia, but a condition that can have some similar symptoms. Okay, the gradual degeneration of cartilage leads to pain, swelling, and other symptoms. Okay, glucosamine and chondroitin have anti-inflammatory properties. Okay, they stop inflammation, or not necessarily stop, but they aid in the reducing of inflammation. They also have some cartilage protecting effects through a variety of different mechanisms. Okay, says this gentleman, Chris here. Okay, so glucosamine and chondroitin protect cells called chondrocytes. Okay, and chondro is a prefix which refers to cartilage, and cytes means cells, and a suffix. And so we're talking about the cells of cartilage, okay, which help maintain cartilage structure. In theory, these supplements have the potential to slow cartilage deterioration in the joints and reduce pain in the process, okay? Could be very useful or something at least to consider supplementing if you have fibromyalgia. Okay, another one that I find very interesting, I actually found this on deep on the forums sort of thing. Some that wouldn't be discussed in usual medical text, but it's a herb, Boswellia serrata, okay, or Indian frankincense, it's sometimes referred as, okay. And I've just highlighted a bit of this study right here to discuss it. So basically it says, in addition to its beneficial use for arthritis, okay, and arthritis have many similar symptoms to fibromyalgia, this gummy resin is also mentioned in traditional Ayurvedic and Unani texts as an effective remedy for diarrhea, dysentery, ringworm, boils, fever, skin and blood diseases, cardiovascular diseases, mouth sores, bad throat, bronchitis, asthma, cough, vaginal discharges, hair loss, jaundice, hemorrhoids, syphilitic diseases, irregular menses or menstrual cycle in females, and stimulation of the liver. Okay, so that's a lot of stuff it's saying, right? But if you look, do some of your own research, which I encourage you to do, it has really potent anti-inflammatory properties. Okay, and it probably says that somewhere around. Yeah, pharmacology strongly point out to its use as an anti-arthritic, anti-inflammatory, and anti-hypolipidemic. Okay, so it controls blood lipids. Okay, and a bunch of other things. Helps with atherosclerosis, so hardening of the arteries, analgesic, pain reliever. Okay, and hepatoprotective. Okay, so protecting the liver. Hepato is a prefix which refers to liver. Okay, so this is a very interesting one. Maybe something to experiment with, do some research. Boswellia serrata. Okay, and a nice simple one to look at last here is the low intake of omega-3 fatty acids, vitamin B6, magnesium, zinc, and antioxidants may also play a role in supporting role in symptom occurrence for fibromyalgia. Okay, so these are some more basic sort of vitamins and essential nutrients, okay, like omega-3s, okay, very anti-inflammatory, vitamin B6 or pyridoxine, essential for energy function, okay, magnesium can help with a lot of the shakiness symptoms that some of the medications used for fibromyalgia. Zinc, very good for sleep, muscle, hormones, very good. Any antioxidants, so vitamin C, vitamin E, coenzyme Q10, N-acetyl-carnitine, any of these sort of things really help with, just sort of reducing inflammation and reducing that oxidative stress brought upon by fibromyalgia. Okay, guys, that's pretty much all for this video. I really appreciate you guys tuning in, and I'll see you in the next video. Thank you.